We eat more ultra processed food than every other developing nation, and we have the worst life expectancy compared to those developing nations. And she wants to look at the root cause and give parents and moms and dads and all Americans the truth about what we're eating so that they can make lifestyle changes.
But without a doubt, food is at the core of health. If we don't eat right, we will become sick. It's just a matter of time. And our country has a lot of issues with being sick and obese and so forth. And ultimately, a lot of the things that I see in our healthcare system today are very disturbing. A lot of the standard of care, the way things are done in the hospitals and in the clinics are, if nothing else, questionable as to whether they're the best things to do. One of my favorite examples has to do with type 2 diabetes, which used to be called adult-onset diabetes, but you can't call it that anymore because now children in schools for the first time in elementary schools have it. And it's a lifestyle disease. It's caused by consuming basically too much sugar, having a metabolic illness that your body can't deal with the sugar that you're consuming. And these patients have, their bodies are producing insulin to try to deal with the sugar they consume. So the hallmark of type 2 diabetes, which is the opposite of type 1 diabetes, where someone's born with an insufficiency typically in their insulin production, type 2 diabetics have massive amounts of insulin, way too much. They're what's called hyperinsulinemic. And what's really stark, and in the last few months alone, in speaking with some people who have basically been diagnosed type 2 diabetic, it's shocking how many of them have been prescribed first oral medications, but then ultimately insulin. So you're giving someone that has way too much insulin, more insulin, and then when that doesn't work, you give even more. And it's mind-boggling to think that a physician could actually believe that's going to ever solve the problem, because it won't. And although insulin will help in the short term in an emergent situation and in bridging the patient to better health, and I'm not saying anyone should stop taking what they're taking, they need to have these conversations with their doctor for any medication. They should always ask, if I take this, doctor, will it make me better? Is this what will make me better? Or is just this a Band-Aid, a stopgap to get me through to doing the things I need to do to get better? And there are so many of these scenarios. And as we've talked before about the pharmaceutical industry and the advertising and the ads that are not always completely forthright as to the potential true benefits, which may be not as much as you would think from the ads, and the potential risks, it's mind-boggling. And one of the challenges in our country, here in the United States,